Hi, we're back. Thanks for staying with us. And joined now by Chris Romandetti. He's the CEO of Medical Billing Assistants Incorporated, MDBL. Chris, good to talk to you again.
Top of the day, sir. How are you doing today?
Doing very, very well. I appreciate you giving us an update in the company. Now, we were talking the last time about your business plan of opening MRI centers in rural areas. Tell us again about that.
Well, you know, Don, the reimbursement and the need, there's a demand for it. Currently, the centers we're looking at are out in the Midwest, like Colorado area, and we have found that reimbursements are significantly higher. Access to the customers, the patients themselves, they love it. So areas that we're looking at, we can put 2, 3 in. We can have a manager in that geographic area. And we've actually seen our reimbursements in facilities we're looking at being in some cases almost 50%, actually 50% higher than, say, maybe in a highly populated area down here in Florida or South Florida where we're located.
Now, Chris, is there a population magic number that you look to, say, okay, if it goes above or below this population magic number, it's maybe not right for us? Have you tried to put a number on that?
Well, you know, you have both. You struggle with both. We like the population, but the minute you typically have an abundant population, then there's too many machines. So, again, in some areas we looked, there could be 8, 10. As a matter of fact, one city we looked at, there was 23 machines within a 12-mile geographical area. Well, the reimbursements are significantly lower. Again, when we go out, defined by Medicare and the government, what a rural area is, it tells you how many people per square mile. And when you go into those areas where you have enough people with proper insurance, they got to have access. People have open policies, and typically it's the hospital that has the machine. And again, the one that we're looking at even now, we're 40, 50 miles away, other than a machine at the hospital. And the payers themselves, the third-party payers we call them, are willing to give us contracts to that make it very lucrative to go into these smaller areas and put equipment in.
Not much time left, Chris, but I've always wanted to ask you this question. I think the health care laws will probably find its way to the Supreme Court. Either way, does that really affect your business?
Well, you know, we had our plan well defined before the health care bill passed. Previously, I had mentioned the 30 million additional Americans that might have access, really do have access today. If they're in dire straits, you can walk in, thank God, to any facility today and still get health care. So those who need it can get it. Who's going to be reimbursed will be what's defined. If the bill goes through, we're seeing that it should increase about another 3 to 4 million scans per year. If it doesn't, it still be in excess of 35 to 40 million scans currently. So, you know, we're still trying to achieve 1% market share one day here of 300,000 scans. It's not going to be an effect that will change our course, but for all those in need of it, we can deal with it either way.
MDBL, Medical Billing Assistants. Chris, thanks for the update.